like to thank you, Dr. Schweitzberg. I'd like to thank SAGES for the opportunity to present my work. I'd like to thank my supervisors, Dr. Daniel Jones and Sovrano Day, and the rest of the co-authors. The title of my study is A Validation of a Novel Laparoscopic Adjustable Gastric Band Simulator. Disclosure, I am in the Canadian Training Fellowship. A little bit of background. We're all aware of the enormous impact obesity is having in this country, as well as globally. The World Health Organization predicts by the year 2015 that there will be 2.3 billion obese individuals. The LAGB is the second most common procedure in the United States. A little bit of training. We are all aware of the changes that are taking place in surgical education. These time-honored training methods of surgery are changing. This is a picture of the Carl J. Shapiro Simulation and Skills Center at Beth Israel Deaconess Medical Center in Boston. Aims, the purpose of our study was to validate a novel VR laparoscopic adjustable gastric band simulator in terms of face validity, construct validity, and content validity. Methods, we had 28 subjects participated in this study. Each subject was shown an instructional video on the procedural tasks. There were two groups, consisted of experts and novice. The experts consisted of PGY5 fellows and faculty, and the novice consisted of medical students, fourth-year medical students, and PGY 1 to 4 surgical residents. Of note, the experts were FLS certified. Analysis, a total of 13 subjects for each group was needed to detect a difference at 80% power with an alpha of 0.05. We used the Mann-Whitney U test for a difference between the two groups. Here's a picture of the LAGB simulator in the Skills Center. You can see that it consists of a fiberglass abdomen underneath the drape and a monitor with laparoscopic tools. There was also two Phantom Omni devices that provided haptic force feedback. Here's another picture of the hardware platform with the laparoscopic instruments intact with sensors. There was a foot pedal also for electrocautery, which is not shown. This slide shows some of the features of the simulator. You can see the stomach anatomy clearly, the liver, the spleen, and the pars flaccida. On the upper right, we had the ability to create bleeding with the electrocautery. You can see in the bottom left-hand corner the smoke effects. We had the ability to create smoke. In this slide, we did have the ability to mimic the pars flaccida technique. In the upper left-hand corner shows the dissection of the pars flaccida. The upper right shows the retrogastric tunneling, and then eventually the grasping of the band, pulling the band around, and placement and locking of the band. This table shows the results of the face validity. Using a 5-point Likert scale, we administered a questionnaire to the experts and the novices. And we asked questions such as realism of the simulator, visual display, force feedback, realism of the equipment, anatomical features, stomach and fat behavior, lap band behavior, and ability to quantify measures of performance. You can see that the total on a 5-point Likert scale was consistently above 3. I think the take-home of this slide is that experts and novices generally agree on face validity of the simulator. In order to assess construct validity, we took a band completion score and an electrocautery score. The total of these two, we deducted a penalty score, which consisted of the number of times the band was actually dropped and the size and number of perforations in the stomach and esophagus. The total score, with 100 being the highest, and everything was relative to this. This is a box plot. It shows the band completion score. You can see on the right, the experts did significantly better than the novices. This is the electrocautery score. Again, statistically significant. The experts performed better than the novices. And with the total score, again, experts did significantly better than the novices with less variability. In order to assess content validity, we used only the expert group, and on a 5-point Likert scale, we asked questions such as, is the VR LAGB a realistic trainer for the LAGB procedure? Is it useful as a trainer for residents, surgeons before their operating room experience? And could it be useful trainer for certification in this field? We consistently had the mean over 3. So somebody press the video. Can you start his video? So I have a little video here showing the simulator in progress. Here you have the electrocautery with the smoke effects on the pars flaccida. You'll be able to see the instrument creating a incision over the peritoneum and then creating a retrogastric tunnel. Eventually the instrument will go behind and the band will appear, and the band will be grasped and pulled around the stomach. So to our knowledge, this is the first laparoscopic gastric band simulator. In our study, it did demonstrate excellent face construct and content validity, and hopefully in the future it can be used as a tool for improving skill and proficiency. And you can see here the band being placed. And eventually locking of the band. Thank you.
That's great.